And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to answer your medical questions on pain management today, Dr. Robert Bulger from the Southwest Pain Group. Just call the number that you see on the screen. It's 1-888-572-4411, or you can visit the website at www.southwestpaingroup.com. Dr. Bulger, this looks kind of exciting to me. We're going to talk a little bit about pain mapping, and I'm not familiar with that at all. What does it have to do with?
Well, it's actually a kind of a new term that's popular, and I think it's because people don't understand the complexities of diagnostic blocks. But essentially, pain mapping is a way for us to find out why people hurt. Because you can't, like Margaret, our caller before, you can't help fix a problem if you don't know where it's at. Pain mapping is essentially this. It's using our knowledge of anatomy, the patient's exam, and our knowledge of nerve blocks, and using discrete nerve block therapy to identify a pain generator. And a pain generator essentially is the tissue that's most likely involved with the pain. And I'd like to give you some examples, which will help people understand it better.
I would just like to ask the question, am I correct in understanding that sometimes pain can come from a totally different area, and that's why this can be so important for people?
That's exactly right. This first diagram here for the viewers, this is called a dermatome, and a dermatome is an area of the body that is subserved by a spinal nerve, and it's kind of the first step in helping map out where the problem is. And each of these different colored areas, Mike, corresponds to a different spinal nerve. So let's start out with some examples which will help the viewers understand the concept of pain mapping. Now, the first case is a 41-year-old lady who came to us. She'd had a hysterectomy about 2 years ago. Now, the hysterectomy went well. There were no problems with the surgery, but she continued to have abdominal pain and groin pain. Now, our obstetrician told me, hey, the surgery went great. I don't know why she hurts. You know, I don't want to keep writing her pain pills. She came to me kind of looking for answers and really basically resigned to the fact that she probably going to have to take pain medicine. And that's not a good thing to have to discover. Well, as it turned out, her pain didn't sound exactly like incisional pain, but if you look on the diagram right here for your viewers, it actually mapped out in this area by her incision, but it was a little bit different than typical pelvic pain. So here's what we did. And I'm going to show your viewers right here. If you look on the spine, different areas of the spine, different spinal nerve roots correspond to different parts of the body. As it turned out, when I did an MRI scan on her, because of course we needed to scan it, I'm going to pull this off. Thanks, Mike. I found out that she had 2 bulging discs. Now, the bulging discs were very mild. The neuroradiologist thought, well, this probably isn't the cause of her pain. So what did we do? We wanted to do the diagnostic mapping. And what that involves is essentially, if you want to take a look right here where the red arrow is, we take a small amount of medication, and for the viewers, we place that medication on the nerve root. So I put a few drops of medication right on that nerve root. And then we wake her up, and we had the lady walk around. We had her move around and see how she felt. As it turned out, she wasn't much better. So we brought her back, and we did the other nerve root, the other one that corresponds to the bulging disc. And it's very important to understand something that we've learned. It's exciting stuff, too, because sometimes a disc that's bulging or doesn't look like it's much of a problem can be. So interestingly enough, after we did her T12 and L1 root block, it turned out that she had a bulging disc that was irritating the nerve. And if you'll lift up that post for me again, Mike, for the benefit of your viewers, in fact, her pain wasn't from her hysterectomy at all. That was a successful surgery. She, in fact, had a bulging disc which was masquerading and causing her to experience pelvic pain and groin pain. Now, that's an example of where we can help someone. And pain mapping allowed us to tell her, look, you're not crazy. You don't need Paxil or Prozac or pain medicine. We can get you better.
Well, she had to be thrilled with that.
As it turned out, we were able to treat this conservatively. She did not need surgery.
Now, you said you had another example for us. Let's get to that one, Dr. Bulger.
There's another example. This was a 52-year-old gentleman who had neck surgery. We talked about neck surgery. And he had a cervical fusion. And so for the benefit of your viewers, he had a C5-6 fusion. And many of you know about neck surgery. Peyton Manning had neck surgery recently. A lot of talk about all his troubles. But in fact, this man's surgery went very well, very well. But interestingly, about 5 years down the road, he began to have pain. Now, the surgery was fine, it wasn't clear to the surgeon why he was hurting. And when he rotated his neck a certain way, he had symptoms that suggested that perhaps this might be nerve irritation. So much like our first lady, we did a diagnostic nerve block to map out this pain. Well, it turned out it didn't change his pain. So the first thing we learned, and it was really interesting, and that's why I actually love this specialty, because it's almost like detective work. It's literally like CSI. It's a way for us to find out where the pain's coming from. And I want to emphasize to your viewers, we work together with some of the best surgeons in Dallas. We're very fortunate. Top surgeons at the Carroll Clinic and Texas Back Institute, many other great surgeons in town use these techniques. And we found that, in fact, his pain, was coming from joints above and below the fusion. So in fact, we were able to do a diagnostic pain block, and we put a little bit of medication right there, a little bit of medication right there on these two joints. We woke him up, and by the way, just for your viewers, people are very comfortable with mapping. We do it with patients comfortably sedated or asleep, so you don't have to be awake for this, which is nice.
Sure. And I think also, Dr. Bolger, because we're running a little short on time, you had some video that you wanted to show us?
Oh, yes. I'd like to let your viewers go ahead and take a look at what a typical mapping session might be. At Southwest Pain Group, we frequently use MRI scans and the diagnostic blocks as part of a total program. And the program involves trying to figure out where the pain's coming from. We use ultrasound, imaging studies, and physical examination. And every patient ultimately has a mapping session and then a discussion where we go through the possible causes of the pain. It's something that we do for every patient at Southwest Pain, and it's probably one of the most exciting and interesting parts of my work.
I'm just going to ask you a question. I know every case is different, but if we were talking about a time to do this, what kind of time were we looking at? Would it take an hour, maybe 2 hours?
Sometimes these sessions can take several visits because it's important to try to figure out what you hurt. And so it might require several sessions to get to the bottom of it, because really we're using evidence, just like a detective solves a crime. We're trying to find the bad guy.
So you're doing everything it can possibly you can possibly do. Find this, help them.
Locating the pain generator is the first step in really helping solve someone's problem.
Okay, we have a number of questions regarding pain mapping, and if you'd like to make an appointment, you can go to the southwestpaingroup.com, and we're going to be right back in a moment with those questions and some answers. Don't go away.